Thanksgiving special for obesity. BMI or body mass index is a measure that uses your height and weight to work out if your weight is healthy. Body mass index is calculated by dividing your weight in kilograms by your height in meters squared, or if you prefer the old school, your weight in pounds by your height in inches squared multiplied by 703. But here's the catch. BMI is not a perfect measure. It doesn't account for muscle mass, bone density, overall body composition, or variations in health among people with the same BMI. So while it's a useful tool, it's not the be-all and end-all of health metrics. Now let's talk about waist circumference. This is another crucial indicator of health risk related to obesity. It's a simple measurement taken around your abdomen at the level of your belly button. It's important to measure waist circumference in all adults to assess obesity-related health risks. But remember, this measure isn't one size fits all. Specific cutoff points exist for different ethnic backgrounds according to well-recognized health guidelines. You might be wondering the waist-hip ratio, another measure often mentioned. Interestingly, it has no advantage over waist circumference alone. So, you can stick with the simpler measure and still get a pretty good idea of your health risks. Let's take a quick look at the classification of weight by BMI and waist circumference. For men, a waist circumference of 40 inches or less is ideal, while for women, it's 35 inches or less. As these numbers increase, so does the risk of health complications. These measures, while not perfect, provide a useful starting point to assess if a person's weight might pose health risks. It's important to remember that everyone's body is different. What might be a healthy weight for one person could pose health risks for another, so it's always best to consult with a healthcare professional for personalized advice. And we have it. A quick overview of BMI, waist circumference, and obesity. Now let's move on to discuss the implications of obesity and how it affects our health. It's not just about numbers. Obesity brings with it a host of potential health complications. The adverse medical consequences are numerous and severe. They range from type 2 diabetes, a condition that affects your body's ability to control blood sugar, to stroke, a sudden interruption in the blood supply to your brain. Certain cancers are also more common in individuals battling obesity. The prevalence of obesity is staggering. About 16% of adults are obese, and a worrisome 32% are overweight. Alarmingly, the percentage of overweight children and adolescents has more than doubled and tripled in the last 25 years. Shifting our focus weight loss, it's important to understand that burning fat and losing weight requires a balance of increased activity and decreased caloric intake. Remember, balance is key. This Thanksgiving, let's be mindful of our health as we enjoy our festive,